So Amy's told me at the consultation that she feels like she looks more tired than she actually is, and that's a really common thing to hear at consultations. The reason for it is usually an underlying issue just underneath the eyes. We have the dark circles. Dark circles can be caused by many things. It can be a lack of sleep, it can be a lack of hydration. Quite often it's something that's developmental, which means that it's there kind of genetically and it's a natural part of the face. In Amy's case, and in everyone's case, there's very thin skin underneath the eyes, so what we're actually seeing, the darkness, is the underlying blood vessels and some pigmentation. In some cases, there's a little bit of volume loss or a natural hollow underneath the eye, and that's where something like a tear trough filler is good to lift the hollow out, to add a bit of projection, and what it means is there's less shadow cast, the light bounces off the skin in a different way, and it looks less dark. It doesn't take a lot of volume, up to between 1 to 2 syringes usually, so 1 to 2 ml. Occasionally we might use some cheek filler as well to enhance that result. It can give you a better, longer lasting result, and that's because the tear trough is supported by the cheek, so if we have good support underneath it, the longevity will be better. So before any procedure, we're always cleaning the skin thoroughly. We use a prep solution which kills any bacteria on the skin. We need the skin to be makeup free, bacteria free. This is classed a kind of riskier area because there's a lot of blood vessels in that area. So one technique is to use a needle and go straight into the tear trough, but my preferred approach and the safer approach is to use a cannula, which is inserted here. Cannula is a blunt instrument, like a little tube, and it runs along and underneath the tear trough area, and then we deposit the filler like that. So from that same position we can then do the cheek. So we're going to put a little bit at the apex of the cheek. The idea with the contour is to emphasise the cheekbone and allow the light to bounce off of this area, so this is literally a 3D effect of that with the filler. And then we're going into underneath the tear trough in the middle cheek, just to provide a tiny bit of support. 0.01, it's not a lot of filler. And that's it. We've used about 1.2 ml of filler in total. Some of that was placed at this point here, the prominence of the cheek or the apex of the cheek, and a little bit underneath in the mid cheek to support the tear trough. The effect of that is that we get a nice contour to the cheekbone, so the light bounces off it. The tear trough was injected as well, so there's filler just in this area here to lift out the hollow underneath the eye, and again the light bounces off it, it looks more uniform.
That's me finished my appointment with Andrew. That was so much easier than I thought it was going to be. The only thing that I felt was when the needle first went in, which was like a little sharp scratch, but apart from that the rest of the treatment was totally easy, pain free and really quick too, so really happy with the results, and I feel like I look nice and fresh now.